Hi, in this presentation I will go through a series of slides that depict the progression of a cavity and what can happen if it is not discovered and fixed in time. This is a representation of a healthy molar. Here we see how a cavity starts. The bacteria in the mouth produce acid that starts to cause decalcification of the enamel and starts to make a little hole. When this hole or cavity is between the teeth, it cannot be seen unless you go to the dentist and he or she takes an X-ray. This is how a deep cavity looks if you were able to see into the tooth. The cavity has penetrated the enamel and has spread into the dentin close to the nerve. Normally a cavity like this has already started to give signs that there is something wrong, like sensitivity when eating sweets or drinking cold liquids. Here you see what happens if the person goes to the dentist and the dentist is able to carefully clean the cavity and place a medicated base in the deep area and then a filling to repair the damage. Now let's look at what happens when the person does not go to the dentist and allows the cavity to continue to grow. By the time you see a hole or cavity in a tooth, it may be so deep that the nerve has already been damaged. Even if the tooth is not abscessed, the nerve is infected and the tooth will be a source of pain and infection if it is not fixed. This is where a root canal is necessary. The dentist cleans the cavity and removes all the infected tissue inside the tooth using very small files. The tooth may have one or several canals. Once the canals are cleaned, enlarged, and disinfected, they are sealed with a special material. Then a filling is placed to cover the hole and repair the damage. If the cavity is extensive, it leaves the tooth weak, and the dentist may recommend a crown to protect it so it doesn't break. With the crown cemented, the tooth should be pain-free and continue to function for many years. Thank you.